that she had been, or she is a diabetic that is insulin resistant, and her blood sugar had never been over 180, but she actually had a total numbness of both feet from the ankles down to include the whole foot on both sides. When I examined her, she had a negative straight leg raising test. She had slightly diminished deep tendon reflexes at the knee and at the ankle. She had no Babinski, and the sensory exam confirmed her report of this stocking type of numbness that began at the ankle and went down to include the whole foot. On examination, she had active trigger points in the iliocostalis and the quadratus lumborum. She had almost every trigger point in the gluteal muscles and in the posterior and anterior thigh going down to the knee. I found essentially almost every trigger point that one could find between her low back and knees on both sides. What was interesting is that when I inactivated the iliocostalis and the quadratus lumborum, first on the right side, all of the trigger points in the gluteal area and the thigh and around the knee disappeared completely with no treatments whatsoever, and her leg felt light and normal down to her knee. She still had a little bit of discomfort below her knee, as well as the neurologic finding of numbness in the right foot. The next trigger points I inactivated were the medial portion of the gastrocnemius and the trigger point in the peroneus longus muscle. When these two muscles, the trigger points were inactivated and the muscles stretched, her pain and tightness in the calf and foot disappeared, and the sensory examination of the foot demonstrated that the numbness had completely disappeared, and the patient indicated her feeling in the right foot was normal. I proceeded to do the same examination, found the same findings, and I did the same treatments on the left, and the exact same response occurred, and she now had normal sensation in both feet. And I should add at this point that I have seen her, I think, 4 or 5 times over the past 8 or 9 weeks, and her neurologic findings in her feet are still the same. Her feet are normal without any type of numbness. So she did not have a diabetic neuropathy, but an entrapment neuropathy that has resolved very rapidly. What's amazing is that she had had this for nearly 4 years, between 3 and 4 years, and it disappeared exactly at the time that I inactivated the trigger points, rather than over a few week period, which would be more normal in terms of the kinds of treatments that I provided. I then turned to the right arm, where her hand problem was still present. She had trigger points throughout the right upper quarter in the back, posteriorly as well as anteriorly, and down into the arm and forearm. All the muscles in those areas had active trigger points, and I inactivated the trigger point with the ML830 in the upper trapezius, followed by the infraspinatus, followed by the pectoralis minor, which testing her arm, that her pulse disappeared when her arm was about 3/4 of the way elevated, so that clearly she had a mild thoracic outlet type problem, which completely resolved in terms of feeling her pulse when I inactivated the trigger point in the pectoralis minor. When I then evaluated her arm, every trigger point in the upper arm and forearm had disappeared, and the patient felt like her arm was normal. However, the problems in her right hand persisted. So I examined her right hand, and found a trigger point in the first dorsal interosseous muscle as well as the opponent's pollicis muscle. I inactivated those two trigger points, and her grip strength returned to normal. All of her neurologic findings disappeared, and her apparent carpal tunnel problem instantly resolved. And to this day, she is almost back to normal. Her symptoms have progressively decreased at each of her visits in terms of her wrist and hand. And part of the problem that it's taken as long as it has to resolve that is that she works extensively in clay and was not using a neutral splint on her wrist when she was doing this, so her wrist was moving more than her as much as her fingers were, and she was not stretching her thumbs and the interosseous muscle adequately, and that has changed now, and I expect her to completely resolve her problem shortly. That's the interesting case. It's not a frequent presentation, but it does happen, and Dr. Terrell describes it in her book as a situation that will sometimes occur, and I've seen it a fair number of times over these years. And these trigger points will either completely resolve or reduce their significance dramatically once those certain core trigger points are done, which is why they should always be done first, because then you won't necessarily have to treat many more of the trigger points, or they'll be easier to treat for you. Are there any questions that you might want to ask about this? I know many of you have either bought an MLA30 and are using it and hope to improve your use of it, or are trying to decide whether to buy one. And I hope this webinar has been very informative for you, and perhaps will help you make such a decision. We have one question that people always ask in every one of these webinars is the treatment paid for? In our area, for the first number of years that I did this, it was not. It's one of the ways that can push you into a cash practice, I suspect, which I think is probably the only way you have to fight the insurance companies, who are actually trying to destroy the whole concept of treating chronic pain. I think it's an intentional approach, because they know it is very hands-on work that's required, and it gets relatively expensive to do that for a fairly long period of time. What they don't recognize is if they gave these patients and saw to it that they got the appropriate treatment early on in their problem, that they likely would not get into this chronic pain problem. They certainly wouldn't have surgery, and the costs would be dramatically lower. The insurance companies, I think, are just looking at the fact that they can raise their premiums when they pay for these high costs for surgery. A surgical procedure on the low back could cost $60,000 to $80,000. I could treat a patient probably for their entire lifetime for that, and obviously they wouldn't need such a lengthy or expensive treatment. When the insurance companies recognize this, I think they will eventually all be paying for treatment with the low power laser. And the microlight laser is clearly not only the safest, but the most effective. I've checked all of them out, and I made that decision nearly 7 years ago, and I haven't regretted it whatsoever. in our area, Aetna is paying the best, Cigna and United Healthcare, and very recently our Blue Cross Blue Shield plan, Care First, has started to pay for it. They don't pay adequately, most of them, and they're treating it as if it's a physical therapy or an occupational therapy treatment. So if there are limits built into the contract, they count against those limits. They also are paying as if it's one of the modalities that a physical therapist is doing. And this is in spite of the paperwork which we send in on every patient that we bill. We send in progress notes, a statement about what was done with the laser, and the fact that it was done by me as a physician personally, and this is not physical therapy, and it's clear that they don't even read it. Aetna tends to pay the best in terms of assuming that this was a medical treatment rather than a physical therapy treatment, but they still don't pay completely. So it's still going to be a bit of a battle. If you depend entirely on insurance payments, you may have a problem using it, but I think if once you do use it on a patient, they will ask for you to continue using it, and it's likely that they'll be willing to pay that extra small amount of money to have it done, have their treatments with something which is risk-free and doesn't hurt. I'm seeing more and more patients who are coming to me based on what they've heard about a cold laser, and for a laser treatment they've looked up on the web and my name comes up, I guess fairly frequently associated with cold lasers in this area, and it's resulted in a significant number of new patients for me. So that tends to mitigate the problems associated with the insurance companies. Are there any other questions? Well, thank you for attending today's webinar. If you think of further questions, don't hesitate to use the these are the references here. And if you haven't seen them before, you can get them from over email by request to me at myml830.com, and or you can use the phone number which is on the screen at 888-789-0745. Any of the things which were talked about today, any questions you have, any concerns, don't hesitate to either call or email me. These messages will get to me pretty quickly, usually within 24 hours of when you send them, and I will try to answer them as quickly as I can. Again, thank you very much for attending, and I hope it was useful for you.